The study that we will present at AACR is the study looking at circulating tumor DNA in patients treated on the phase 3 FLAURA2 clinical trial, which evaluated osimertinib compared to osimertinib in combination with chemotherapy as first-line therapy for patients with advanced EGFR-mutant non-small cell lung cancer. The study design is a randomized phase 3 clinical trial where patients are randomized to single-agent osimertinib or osimertinib given together with platinum-based chemotherapy. The clinical results of the study have been presented and published and demonstrated an improvement in progression-free survival, about a 9-month improvement in patients who received a combination of chemotherapy and osimertinib compared to osimertinib alone. Well, these results provide a potential new therapy option for patients newly diagnosed with advanced EGFR-mutant lung cancer, where the standard of care currently is single-agent osimertinib. However, our study demonstrates that there is an improvement when chemotherapy is used as in combination with osimertinib in such patients as their initial treatment. In the study at AACR, we'll focus on studying the circulating tumor DNA in patients in both arms of the study, and the findings reveal that patients who have detectable circulating tumor DNA for an EGFR mutation prior to treatment tend to have a worse prognosis compared to those who have no detectable circulating tumor DNA. In addition, patients with circulating tumor DNA do better when treated with osimertinib and chemotherapy compared to single-agent osimertinib. And also, patients who we also evaluated the circulating tumor DNA at different time points during the treatment, at 3 weeks or 6 weeks into treatment, and patients who no longer had detectable circulating tumor DNA at 3 weeks or 6 weeks had a better outcome than those who had persistent detectable circulating tumor DNA. However, in both cases, whether you had persistent circulating tumor DNA or did not, patients did better with a combination of osimertinib and chemotherapy. Well, I think despite the study being overall positive for the combination compared to single-agent osimertinib, we still don't have a completely clear understanding of who actually needs the combination therapy and who can do well with single-agent osimertinib. So this study that we're presenting at AACR suggests that if you have ctDNA present at diagnosis with advanced EGFR-mutant non-small cell lung cancer, that may be a feature that should be taken into consideration, as that may be associated with a better outcome if the patient is treated with a combination treatment approach. There are other factors that may go into that decision of whether you use a single-agent osimertinib or a combination with chemotherapy, but presence of cell-free DNA or circulating tumor DNA at diagnosis may be a feature that will help make that decision for the individual patient. I just add that there are ongoing studies looking at circulating tumor DNA in patients who are treated with osimertinib, and if there's persistent circulating tumor DNA following treatment with osimertinib, patients are, the question becomes, is that the time to add chemotherapy or not? And there's studies trying to evaluate that idea, as opposed to in the current study, where chemotherapy was started from the beginning in the arm of patients that received the combination treatment. So the timing of chemotherapy, whether that should be used from the beginning in combination with osimertinib or added later on based on evolution of circulating tumor DNA, I think still remains an important question. And there are ongoing studies evaluating that concept. And hopefully over the next couple of years, we'll have an understanding and results from those studies as well.